how does the meningitis come about in terms of what causes it exactly?
Okay. The meningitis that we are most afraid of as healthcare workers, and I think the one that is referred to as occurring in outbreaks, is a bacterial form of meningitis. Now, there are several bacteria that can cause meningitis, but the one that we're most interested in is a type called Neisseria meningitidis. And this is what has been found to occur in outbreaks, like what they were depicting, like happened in the Hajj. So these bacteria, you know, our bodies are not sterile. So at any point, you might find 10 to 15 of the percent of the population actually carry these bacteria within their nasal spaces and upper respiratory tract. Within what was described as the meningitis belt, which is 26 countries all the way from Benin in the west, including Kenya in sub-Saharan Africa, we tend to have more meningitis, meaning that we have higher carrier rates, so a larger percentage of the population, even when healthy, if you check them, you find that they do have, they could be carrying the bacteria. When there is an epidemic, an even higher percentage of the population is actually carrying the bacteria. But if your own immune system, for one reason or another, gets weakened, then these bacteria are able to penetrate all the defenses of the body, escape the white blood cells that would normally be able to kill them. And as they multiply within the bloodstream, if they do get to the brain and are able to infect those outer layers, and that infection is not controlled, then the person develops meningitis. Yes.
Okay, all right. You talked about bacterial being the most severe.
Yes.
And then we also have viral, and the other one is fungal.
Yes.
So between the three of them, yes, we know that bacterial is the most severe. And in terms of from the onset, like when the person is diagnosed with meningitis to getting treatment, in terms of the delays, what could happen, and in terms of severity between the fungal, bacterial, and the viral infections?
Maybe it would be helpful to talk about which populations are most at risk, so that then we know even who needs greater protection. So young children under the age of 10 will get more severe forms of disease. And for the very young, you can imagine their own immune system is not yet even developed. So if they are exposed, then they are also at greater risk of developing meningitis. Elderly people, because as you grow older, your immunity also starts to wane. And you may also have other diseases such as diabetes or cancer that are already affecting your immunity. So again, if you were exposed to the meningitis bacteria, you'd be more likely to get it. Populations who are living together in close quarters, where there's overcrowding, maybe not very good ventilation, then again you're at risk, which is why you hear it. There's outbreaks in colleges, there's outbreaks in the military, there's outbreaks when large populations have gathered at the Hajj. So between you being exposed and you developing disease, it can take up to 10 days. And during that period, you could infect others, but you have not yet developed symptoms. So people are not even aware that you have meningitis. So you see, you're at risk to those around you at that point in time. So after that period, which you call the incubation period, the disease can develop very quickly, depending on a person's own immunity. So if you do not get medical help within 24 to 48 hours, a period of actually 2 days, about 50% of those who have Neisseria meningitidis will die without treatment. And even with treatment, about 1 in 10 will still develop permanent effects of having been infected with the meningitis. So that gives you an idea of the timelines. If you suspect you have meningitis, rush to hospital.
To hospital. Okay, and of course we'll talk about the symptoms of, some of the signs and symptoms to watch out for.